CMA Exam Practice Test 2026. Question 1. In obesity, body weight exceeds normal by at least 10%, 20%, 30%, 40%. Obesity is defined as a body weight 20% or more above the ideal weight for a person's height and frame. Question 2. Psychology is the scientific study of the mind, the scientific study of behaviors, the scientific study of mental processes, all of these. Psychology encompasses the scientific study of the mind, behaviors, and mental processes. Question 3. It is permissible to release private and confidential information about a patient when you disagree with the patient's choices, when the patient has signed a release form, to a friend of the patient who is concerned about the patient's well-being, over the telephone when others can overhear. Confidential information can only be released legally and ethically when the patient provides explicit written consent via a release form. Question 4. Which of the following fractures of the bone is common in children? Comminuted, open, incomplete, compound. Greenstick fractures are common in children because their bones are more flexible and tend to bend and crack rather than break completely. Question 5. Which of the following contains the central meaning of a word? Prefix, suffix, root, combining vowel. The root word provides the primary, central meaning of a medical term. Question 6. Diverticulosis occurs particularly in the lungs, cecum, mouth, anus. Diverticulosis is a condition characterized by outpouches, diverticula, forming in the walls of the large intestine, particularly the colon. Question 7. The goal of the 1996 AAMA role delineation study was to revise and update the CMA exam questions, revise and update the standards used for the accreditation of medical assisting programs, create a new role and policy of practicing medicine, establish a new organization that would combine the AAMA and AMT into one organization. The 1996 AAMA role delineation study was conducted to ensure that the CMA certification examination reflected current medical assisting practice. Question 8. A translucent band that is present in thick skin is called stratum corneum, stratum granulosum, stratum germinativum, stratum spongiosum. The stratum lucidum is a clear, translucent layer of the epidermis found only in the thick skin of the palms and soles. Question 9. The first period of menstrual bleeding is called menses, menopause, menstruation, menarche. Menarche is the medical term for the first occurrence of menstruation in a female. Question 10. An 18-month-old boy temporarily forgets potty training when his parents bring his newborn sister home from the hospital. This is an example of which of the following defense mechanisms? Repression, regression, rationalization, introjection. Regression involves returning to an earlier stage of development or behavior in response to stress, such as the arrival of a new sibling. Question 11. The suffix gravida refers to a pregnancy, the condition of aging, a serious condition, a stomach ache. In medical terminology, the suffix gravida indicates pregnancy or the number of times a woman has been pregnant. Question 12. A prolapse of one section of the intestine into the lumen of another segment, causing intestinal blockage, is called intussusception, diverticulosis, volvulus, Crohn's disease. Intussusception is a condition where a part of the intestine folds into the section next to it, akin to a telescope, causing obstruction. Question 13. A dying patient refuses to eat, refuses visitors, and refuses further medical treatment. According to Elizabeth Kubler-Ross, this stage of dying most likely represents denial, depression, anger, acceptance. Withdrawal, refusal to eat, and isolation are characteristic behaviors of the depression stage of the dying process. Question 14. A crime punishable by a fine or imprisonment for less than 1 year is known as a misdemeanor, felony, mitigation, mutual assent. A misdemeanor is a lesser criminal act that is generally punished less severely than a felony, typically by fines or less than a year in local jail. Question 15. Which of the following behaviors might be displayed by a medical assistant who is behaving unprofessionally? Knocking on the door before entering the examination room. Using a term of endearment when talking to a patient. Explaining long delays to patients waiting in the reception area. Being calm while dealing with an angry patient. Using terms of endearment, like honey or sweetheart, is considered unprofessional and boundary crossing in a clinical setting. Question 16. How many glasses of water a day should people drink on average? 3 to 5, 6 to 8, 10 to 12, 9 to 11. General health guidelines typically recommend drinking 8 8-ounce glasses of water a day, which equals about 6 to 8 glasses. Question 17. The prefix "api" means good, out, off, within. The prefix "api" is of Greek origin and means upon, over, or above. Question 18. The strands of DNA in the nucleus are called chromatin, nucleolus, network, granules of RNA. Chromatin is the complex of DNA and proteins that forms chromosomes within the nucleus of eukaryotic cells. Question 19. The Uniform Anatomical Gift Act includes the provision that physicians who accept organs and tissue in good faith, relying on apparently valid documents, are protected from lawsuits. The time of death must be determined by a physician. Any person over 18 years of age may give all or any part of his or her body up after death for research or transplantation. None of these. The Uniform Anatomical Gift Act establishes the regulatory framework for organ donation, encompassing donor rights, physician protections, and death determination rules. Question 20. According to Maslow's hierarchy of needs, which of the following is a biological need? Approval, shelter, love, award. Shelter, along with food and water, is considered a fundamental physiological or biological need at the base of Maslow's hierarchy. Question 21. A 74-year-old man has severe gangrene of the right foot and right lower leg. His physician recommends above-the-knee amputation to prevent further problems. The patient refuses to consider this recommendation and states that he will stop smoking so that amputation will not be necessary. Which of the following defense mechanisms is this patient demonstrating? Denial, repression, rationalization, compensation. The patient is ignoring the severe reality of gangrene and irrationally believing that stopping smoking now will reverse the permanent tissue death, which is a classic presentation of denial. Question 22. The prefix "peri" means behind, underneath, inside, half. The prefix "peri" comes from Greek and means around or surrounding, as in pericardium, around the heart. Question 23. Vitamin B9 is also known as cyanocobalamin, niacin, riboflavin, folic acid. Vitamin B9 is commonly known as folic acid or folate, which is essential for DNA synthesis and cell growth. Question 24. All of the following are causative factors for pernicious anemia except vitamin B12 deficiency, folic acid deficiency, lack of intrinsic factor, decreased hydrochloric acid in the stomach. Pernicious anemia is specifically caused by an inability to absorb vitamin B12 due to a lack of intrinsic factor, not a folic acid deficiency. Question 25. Which of the following terms means inflammation of the inner lining and valves of the heart? Valvulitis, vasculitis, pericarditis, endocarditis. Endocarditis refers to the inflammation of the endocardium, which is the inner lining of the heart chambers and heart valves. Question 26. An organism that obtains its nutrients from dead organic matter is called Diplococcus, Chlamydia, Saprophyte, Mycoplasma. A saprophyte is an organism, usually a fungus or bacterium, that lives on and gets its nourishment from dead or decaying organic matter. Question 27. An irritable and complaining patient states to you that everyone around him is negative and irritable. You recognize this defense mechanism as sublimation, repression, rationalization, projection. Projection is a psychological defense mechanism where a person attributes their own unacceptable feelings or traits to others. Question 28. A physician is required to report all of the following except births, deaths, abuse, communicable diseases. Physicians are legally mandated to report vital statistics, births, deaths, and public health/safety issues, abuse, communicable diseases. Strokes are not mandated reportable events. Question 29. The most common cyanotic cardiac defect is patent ductus arteriosus, angina pectoris, ventricular septal defect, coarctation of the aorta. Tetralogy of Fallot is the most common congenital heart defect that causes cyanosis, a bluish tint to the skin due to low oxygen levels. Question 30. Which of the following items is the most important for medical assistants to keep in mind during their daily work routine in medical offices? Burglary, confidentiality, privilege granted to a physician, consent. Patient confidentiality is a paramount ethical and legal obligation, example HIPAA, that impacts every aspect of a medical assistant's daily routine.